Men over 60, have you noticed that your morning wood just is not what it used to be? You are not alone, and here is the surprising truth. It is not just a natural part of aging. In fact, what I am about to share with you will shock you, and it may even surprise your doctor. Your body is talking to you. When morning wood starts fading away, it is sending a clear warning sign, one that you cannot afford to ignore. And the best news? You can fix it naturally. No pills, no risky procedures, just proven, science-backed steps. I am Dr. Lauren Mitchell, a board-certified urologist with over 15 years of experience helping men over 60 restore their vitality, energy, and yes, their bedroom performance. Morning wood is more than a confidence booster. It is actually a powerful indicator of cardiovascular and hormonal health. And when it starts fading, it is not just about libido, it is about what is happening inside your blood vessels, your heart, and your hormones. Let me be clear, aging is not the villain here. I have seen men in their 70s and 80s wake up every single morning with healthy, strong erections. The problem is lifestyle changes, hidden medical issues, and overlooked warning signs. And pills? They do not fix the cause. They just mask the symptoms, and sometimes they make the underlying issue worse over time. Morning wood happens during REM sleep, your body's way of keeping your penile tissue oxygenated and healthy. But as we age, 3 big changes affect it. 1. Blood vessels stiffen, reducing blood flow. 2. Nitric oxide production slows down. The signal your body sends to trigger erections gets weaker. 3. Testosterone drops, making nighttime and morning erections less frequent. Your penis is often the first place these changes show up. If blood is not flowing well here, it is likely not flowing well to your heart or brain either. Researchers discovered back in 1975 that men experience multiple erections every night during REM sleep. These are not purely sexual, they are maintenance for your tissue. But here's the kicker, REM sleep may still happen, yet if your blood flow is sluggish, those signals do not translate into strong erections. Think of it like sending a text, but the Wi-Fi is barely working, the message is there, but it never gets delivered properly. Before I show you the solution, you need to know about the silent saboteurs that could be destroying your morning erections without you realizing it. Hidden danger. Number 1, blood pressure medications, beta blockers, and diuretics can reduce blood flow to the penis by up to 40%. If you're taking these, talk to your doctor about alternatives. ACE inhibitors are often erection friendly. Hidden danger. Number 2, antidepressants. SSRIs like Prozac and Zoloft don't just affect mood, they can kill libido and morning erections. Nearly 70% of men on these medications experience sexual side effects that doctors rarely warn about. Hidden danger. Number 3, sleep position. Sleeping on your stomach compresses blood vessels and reduces overnight blood flow. Side sleeping or back sleeping allows for better circulation during those crucial REM cycles. Hidden danger. Number 4, late night snacking. Eating within 3 hours of bedtime spikes insulin, which suppresses testosterone production overnight. Your body should be repairing and regenerating hormones, not digesting food. I remember one patient, Robert, age 67. He came to me embarrassed, saying, "Doc, I thought it was just old age." His morning erections had been gone for 3 years. We ran some simple tests and found mild cardiovascular issues. Within 3 months of following my natural protocol, improving his sleep, adding certain foods, and walking daily, Robert not only got his morning wood back, but he said his wife was blown away by his renewed stamina. The breakthrough. The truth is, you can reverse this. You just need to work on 3 key areas: sleep quality, cardiovascular health, and natural hormone support. When you address all 3, you are fixing the root cause, not just patching the problem. Warning signs you shouldn't ignore. But first, let me give you a self-assessment. If you have 3 or more of these symptoms along with disappearing morning wood, you need to see a doctor immediately. chest pain or shortness of breath during mild exercise, numbness or tingling in your hands or feet, extreme fatigue that doesn't improve with rest, difficulty maintaining erections during intimacy, loss of muscle mass despite staying active, mood changes, or depression. These could signal diabetes, heart disease, or severe hormone imbalance. Morning wood isn't just about sex, it's your early warning system. The solution. Solution number 1. Optimize REM sleep, 450 to 490 seconds. Keep a consistent bedtime and wake time. Keep your bedroom cool and pitch dark. Avoid alcohol before bed. It reduces REM sleep. Try 5 minutes of deep breathing before bed to improve oxygenation. Solution number 2. Boost cardiovascular health, 20 to 30 minutes of daily brisk walking. 2 strength training sessions per week. Eat more nitrate-rich foods like beets and spinach to relax blood vessels. Solution number 3. Support testosterone naturally. 15 to 20 minutes of sunlight daily for vitamin D. Maintain a healthy waistline. Try intermittent fasting or limit eating to a 10-hour window to regulate hormones. Now, for those of you who want to accelerate your results, here are my advanced strategies. The 4-7-8 breathing technique before bed. Inhale for 4 counts, hold for 7, exhale for 8. This activates your parasympathetic nervous system and improves overnight recovery. Cold shower finish. End your morning shower with 30 seconds of cold water. This boosts circulation and increases testosterone production naturally. The bedroom temperature trick. Keep your bedroom between 65 to 68 degrees Fahrenheit. Your body produces more growth hormone and testosterone in cooler environments. Strategic zinc timing. Take 15 milligrams of zinc 2 hours before bed. Zinc is crucial for testosterone production, and nighttime is when your body does most of its hormone manufacturing. Bonus tip, the nitric oxide boost. Here's a quick win. Drink beetroot juice or eat a handful of spinach about an hour before bedtime. The nitrates convert to nitric oxide, improving nighttime blood flow. Let me set realistic expectations. Week 1, you might not see morning wood yet, but you'll sleep deeper and wake up more refreshed. Week 2, energy levels improve, and you may notice occasional morning stiffness returning. Week 3 to 4, libido starts increasing and morning erections become more frequent, but may not be fully firm. Week 5 to 6, morning wood becomes more consistent and erection quality during intimacy improves noticeably. Week 8 to 10, full restoration for most men, strong, reliable morning erections that last. Week 12 plus, these improvements become your new normal, and you'll likely notice benefits in energy, mood, and overall vitality. Timeline and expectations. Weeks 1 to 2, better sleep, more daytime energy. Weeks 4 to 6, boost in libido and stronger erections. Weeks 8 to 12, consistent, reliable morning wood returns. I've seen men fail with this approach, and it's always due to these 3 mistakes. Mistake number 1. Trying to rush results, some men think more exercise or supplements will speed things up. Your body needs time to rebuild blood vessels and hormone production. Patience is key. Mistake number 2. Focusing only on the physical stress and anxiety can override even perfect physiology. If you're worried about performance, that worry itself can prevent morning wood. Practice stress reduction techniques. Mistake number 3. Inconsistency. This isn't a 30-day challenge, it's a lifestyle shift. Men who see lasting results make these habits permanent, not temporary fixes. Morning wood is not just about sex. It is a health signal. Restoring it means you are improving your heart health, brain health, and overall vitality. Your body wants to bounce back. Give it the tools, and it will. Remember, every man is different. Some of you will see changes in 2 weeks, others might need 3 months. But if you stick with these strategies, your body will respond. I've seen it happen hundreds of times in my practice. Commit to these steps today. Subscribe to my channel, and next week, I will reveal the hidden connection between sleep apnea and erectile performance, and why 1 in 3 men over 60 have it without knowing. Now, let's talk about something most doctors won't address: the mental game. I've had patients who did everything right physically but still struggled because of what was happening upstairs. Performance anxiety creates a vicious cycle. When morning wood disappears, many men start checking every morning. Did it happen? Is it strong enough? This anxiety actually releases cortisol, which suppresses testosterone and makes the problem worse. The partner factor: your partner's reaction matters enormously. I've seen relationships where the partner became overly concerned, asking questions like, "Are you okay?" every morning. While well-intentioned, this creates pressure that can delay recovery by months. Let me share 3 more success stories that show how different this journey can be. Michael, 62. I was skeptical about the natural approach, but after 6 weeks, I woke up feeling like I was 30 again. My wife noticed I was happier and more confident in all areas of life. James, 69. The walking and better sleep helped, but the real game changer was stopping my late-night TV snacking. Within a month, everything came back stronger than before. Carlos, 65. I thought my diabetes meant game over. But Dr. Mitchel showed me that better blood sugar control could restore function. It took 3 months, but it worked. Here are the most common questions I get. What if I'm doing everything right, but still not seeing results? First, get your testosterone and thyroid levels checked. Sometimes there's an underlying hormonal issue that needs medical attention alongside lifestyle changes. Can I speed this up with supplements? L-arginine, citrulline, and vitamin D can help, but they're not magic bullets. Think of them as 10 to 20% boosters, not complete solutions. Most partners become supportive once they understand the bigger picture. Is it normal to have good days and bad days? Absolutely. Recovery isn't linear. Stress, poor sleep, or even what you ate can affect things day to day. Focus on the overall trend, not daily fluctuations. And if you're waking up tired despite getting 7 to 8 hours of sleep, you might have sleep apnea, which destroys morning wood even faster than aging. I'll show you a simple 2-minute test you can do at home to find out. Hit that notification bell so you don't miss it. You're investing in your cardiovascular health, your energy levels, your confidence, and your relationships. Every positive change you make ripples out into every area of your life.